My name is Bill Charnetski. I'm from AstraZeneca. For those of you who don't know, AstraZeneca is a truly innovative pharmaceutical company. It's a global company. We have presence in about 100 countries around the world, over 55,000 employees. And the pharmaceutical industry is in a period of real flux right now. Our mandate globally is to focus on the delivery of valued medicines to make a meaningful difference in patients' lives. So we're very much focused on the discovery and delivery of innovative medicines to patients in Canada and around the world. I get the pleasure this morning of introducing Dean Carol Stevenson, one of the true visionaries without whom iChill wouldn't exist. But before I do that, I get the opportunity to share with you three thoughts that are really the underpinnings for AstraZeneca's corporate and personal, my personal and other personal, other individuals at the company's personal support of iChill. We truly believe that this is something whose time has come, and that the center is something that is able to make a very, very important difference in the development of the healthcare sustainability policies in our country. So while I'm going to share these thoughts as thoughts from the company, I want you to know that they really are my own personal views. So I think there's probably three reasons why AstraZeneca has been so deeply involved with the center from the very beginning. First, the old adage that necessity is the mother of invention. We feel that really applies to the issue of the future sustainability of healthcare within Canada. And that more than I think anything else is why we're here. Why are we in this situation? You heard lots about it last evening. You'll hear more about it today. It kind of comes down to two Ds, if you will, demographics and deficits. So as you all know, we are now in a situation where this predominant population cohort called the baby boomers is approaching retirement age. We also are in the wonderful situation where people are living longer than they ever have been. And these are all good things. In fact, that last point, the fact that people are living longer, is a real testament to the work that many of you do, and many of the others of you are studying to do, which is to develop new technologies in lots of different ways, including medicines. So we have so many new things that have come to bless the world over the past number of decades. The people are just living longer, and that's a great thing. Now, the challenging side for healthcare sustainability, of course, is that a large portion of healthcare spending happens in those later years. So we've got this wonderful situation where new technologies are allowing people to live longer. We've got a whole bunch of them that are approaching retirement age, and that's all terrific. But there is a cost, an increasing cost to delivering the healthcare to these people. Now, that was challenging enough a couple of years ago, but then, however you choose to describe it, we had something akin to an economic meltdown globally. And so governments around the world, including nationally and in each of the provinces in Canada, had to spend an awful lot of money. And as a result, they're in deficit situations. So now we have the increasingly challenging world of higher healthcare costs together with the deficit challenge that we're faced with. So, if there's one situation that breeds innovation, it's having to do more with less, to really having to figure out how to deliver health care to those who need it on budgets that are not going to be increasing in the same way that they might otherwise. So we really do feel that now is the time for innovation. You're going to hear lots about that today. It might be technological, it might be process, it might be social, but we really, really do need to bring innovation to the fore if we want a sustainable healthcare system. Secondly, solving these increasingly challenging and complex healthcare problems is not going to happen by some, one waving a magic wand that just sort of decrees that everything will be better. It's not going to happen. There is no such thing, as we all know. And instead, it's going to happen in different gatherings like this one and others around Canada where people have put the best thoughts on the table and really come up with great ideas. And together, probably as the collective, we will make our incremental innovation that will lead to real sea change. But we feel very strongly at AstraZeneca that those solutions are going to come from multiple sectors sitting at the table. And it's going to be everyone. Nobody has a monopoly on good ideas, and it's also going to be incredibly important to bring all the different perspectives within this complex and complicated healthcare system to the table. In our view, it's going to be policymakers, it's going to be the people who make medical devices, it's going to be the people who discover and deliver your medicines, it's going to be academics, it's going to be people from business, it's going to be people from the public sector. It's going to be a whole bunch of people putting their best thoughts forward. Our view, and I think many of you in the room share this, is that health care is one of those issues that really does connect us all. All of us are bound together by cracking this nut on healthcare sustainability, and we feel that our company, AstraZeneca, and the innovative pharmaceutical industry, as well as all the things that you folks do, are very much going to be a part of that. Thirdly, the partnerships that we're talking about to produce these solutions are going to require a new kind of leadership. Actually, I had an article published in the National Post a few weeks ago where I mentioned iChill specifically as being an area that is really educating the leaders of tomorrow in the healthcare field. So many of you are right in the middle of this. Others of us have benefited from it. But at the end of the day, the kind of leader that's going to get us to a better place in healthcare sustainability is going to be one who is comfortable moving between the worlds of government and business, policy making and the implementation of policy, innovation and commercialization. I don't think they're the same thing. Like we're going to need a breed of leader, men and women across this country that are able to move in a way that frankly, I'm not sure all of us have been able to move in the past. And that brings us to iChill. We think the center is absolutely growing those leaders of tomorrow, and we're just so proud to be associated with it. You know, in that article, we called them MBA revolutionaries, and we really, really do think that's true. It's people who aren't just determined to succeed, but really to transform quite significantly the world in which they live. So the phrase that you'll hear throughout today is innovation takes leadership, and I couldn't agree more. But that leadership will also come through a new form of collaboration and partnership that each and every one of you is capable of doing. Many of you are already doing it. And the more that we can help you do that in the way that that iChill is today, I think the better off the whole system is going to be because of it. So we are very, very proud to be one of the founding and title sponsors of the conference. I really, really am honored. I don't use that word loosely. I really am honored to be here with everyone as we try to advance this issue to the best of our capabilities. And I really want to thank Kelly and Dean Stevenson and everybody else who's made this thing a possibility, because of course without them, I certainly wouldn't be here and you probably wouldn't be either. So thank you very much to everyone. Sometimes I sort of feel like the guy at the Super Bowl that's, you know, there on behalf of GM or something and saying, on behalf of General Motors, I present. Anyway, that's a good segue for the Dean. So, Dean Carol Stevenson, I think many of you know an awful lot about her, and as I said at the beginning, and as you have heard a couple times today and last night, she truly is a visionary, and without her support and wisdom and guidance, the center wouldn't exist. So she really is an important part of everything that we're doing today. But it's one of those things where it's sort of like, it's that and more. Since taking on the role as dean, she has set an ambitious goal to dramatically advance the practice of business management and leadership, and to create business leaders who think globally, act strategically, and contribute to the societies in which they operate. And you know, there aren't three more fundamental tenets to the center as one example of how important that work is. So this goal is one that our whole health system should keep in mind. I think you probably agree about that, and it's why iChill exists. Our goal, as you've heard before, is to advance the practice of business management in healthcare, to identify global solutions and develop global leaders, to strategically meet the challenges of healthcare, and of course, to contribute to society a better healthcare system for all its citizens.